So for today's video, I'm going to do a written demonstration that is all about oxygen therapy. So first, let me give you what is the meaning of oxygen. So oxygen is a colorless, odorless, tasteless gas which can assist patients in a variety of circumstances. And it is universally accepted for routine use in hospital setting. So oxygen constitutes of 78.8% of the mass of water and 20.9% of the volume of the air. So oxygen therapy benefits the patient by increasing the supply of oxygen to the lungs and thereby increasing the availability of the oxygen to the body tissues. So it is appropriate levels of oxygen vital to support cell respiration. So high blood and tissue levels of oxygen can be helpful damaging depending on circumstances. So hyperbaric oxygen therapy is the use of high levels of oxygen for treatment of specific diseases. So the definition of oxygen therapy, it refers to the administration of supplemental oxygen as a part of managing illness. So in healthy individuals, oxygen is absorbed from the air in adequate amounts, but certain diseases and conditions can prevent some people from absorbing enough oxygen. So for the purpose of this is oxygen therapy is a key treatment in respiratory care. The purpose is to increase oxygen saturation and tissue where the saturation levels are too low due to illness or injury. And breathing prescribed oxygen increases the amount of oxygen in the blood, reduces the extra work of the heart, and decreases shortness of breath. So it can be ordered for the following. So the first one is the respiratory problems, so such as the severe respiratory distress, such as the acute asthma or pneumonia. Then the chronic obstructive pulmonary disease or COPD, including chronic bronchitis, emphysema, and chronic asthma. So it documented hypoxemia or cardiovascular problems, acute myocardial infarction or such as heart attack, then pulmonary hypertension, then pulmonary and altered mental status due to effects of anesthesia, then decreased levels of consciousness or unconsciousness, such as shock, trauma patients, or severe seizure patients.
There are some physical indications in this procedure. So the first one is the partial pressure of oxygen after below 25 mm per mercury. The second one is the saturation oxygen is than 80% resting. Then the third one is the partial pressure of oxygen less than 55 mm per mercury or 88% for 5 minutes per sleep. Then the fourth one is the abrupt and partial pressure of oxygen is 10 mm per mercury or 5% in oxygen during sleep. Then symptoms or signs of heart failure or pulmonary hypertension. Then the last one is the partial pressure of oxygen is 55 mm per mercury or 88% during exercise. For the contraindications, there are no contraindication to administering oxygen, and if a nurse has any concerns about providing oxygen, they should contact physician first. Then exercise caution with oxygen administration of chronic obstructive pulmonary disease or COPD patients. So for the materials, we have only the oxygen supply pipe or cylinder. For oxygen delivery devices, low flow devices or such as the nasal cannula, simple face mask, partial reverter mask, non-reverter mask, and vendor mask. For high flow devices such as air entrainment mask, zip mixing, aerosol mask, tracheostomy collars, the tube adapters, and face tents, oxygen tube. Then for resuscitation or specialized devices, we have the bag mask, pocket mask, anesthesia machine,
So, explain to the client what you're going to do and what is the oxygen therapy is all about, and if the procedure is good to her or him. Then observe for skin and mucous membrane color for cyanosis, and note also for the breathing patterns, note for the depth of respiration and presence of tachypnea, bradypnea, or orthopnea. And also the chest movements, the chest wall configuration such as the kyphosis. Then the lung sounds audible by auscultating the chest and by ear, such as if there is crackles, crepitations, ronchi, and wheezing. And note all the observation to the client.
So the next method is the planning. So in planning, we need to assemble all the equipments that we need. So we need an appropriate oxygen delivery system. So we have a nasal cannula like this one, and then the oxygen tank, and then the flow meter. This one, then the humidifier. So it is for a high flow oxygen therapy. Then the no smoking sign. So now let's proceed to our implementation. So the first thing to do is to review the physician's order to ensure that it includes the methods of oxygen therapy, and also to ensure that we need to identify the client. Okay. Then next thing to do is to wash our hands with these procedures. So, in administering oxygen by a nasal cannula, we need to insert the flow meter in the oxygen tank like this one. Then, get the oxygen tubing and pack it to the nasal part of the flow meter. So, we need the tubing. So, na-butan na natin siya. Then, after that, so, we need to put it to the prescribed oxygen rate using the flow meter. So, we need the exact or prescribed oxygen rate. Then, make sure that the air of the oxygen is flowing in the oxygen tube. Then we need to hold the nasal tubing in its proper position in applying to the nose part of the patient. So in applying the nasal cannula to the nose part of the patient, we need to pat it like this. So ano siya, ang iyahang upper portion is below siya. So we need to pat it like this. First is to insert the nasal cannula to the nose part of the patient, and next is to the ear of the patient. So in the nasal cannula is na siya adjustment para makakuha na to kung asa mas comfortable ang patient. So mapush na to siya paryaan na or pwede pod paryaan na. So that's the thing we need to do in administering the oxygen by a nasal cannula. So by administering oxygen by a simple oxygen mask, so we need to insert the flow meter to the wall outlet with the oxygen tank, then attach the oxygen tubing to the flow meter. Then if you are going to use a high flow oxygen therapy, then we need to attach the oxygen tubing to the humidifier. Then turn on the oxygen with its prescribed rate. Then we need to attach the mask to the face of our patient. Then by placing it from the nose to the chin, then you can adjust also the metal ring over the nose, and then control it to the face of our client. So for the evaluation, perform follow-up based on the findings that develop from expected normal for the client. Then relate findings to previous data if available. Then also reports significant deviation from normal to the physician. So for the documentation, document findings in the client record using forms or checklist supplemented by narrative notes when appropriate. So this includes the flow rate, client's reaction, and etc. So it is for the legal purposes and to have proper documentation. So that's all the procedure for the oxygen therapy. So